COVID-19. This one on the really important subject of how to understand your insurance coverage and write an appeal letter, which I know is daunting for pretty much everybody. So we have a lot of information that we're gonna cover today. And why are we doing this session on SBU this time? Is because it's just not easy. And getting health insurance companies to pay for the services that we need and the treatments that we expect is a really difficult task, especially if you're your own advocate. And so that's one of the things that we also want to be sure that adults with spina bifida in particular are able to do, is to be equipped with information so that they can be their own advocate. And just, a very simple message, which is just don't give up. It's difficult, but just keep working at it and don't give up so that you can get what you need. And so today we're going to be discussing, like I said, a lot of information. We're just basically going to discuss like what is commercial and private insurance? What is Medicare? What is Medicaid? What do they include? What are your rights as a policyholder? How, if there comes a time that you need to, and pretty much someone always has to, is how to write a letter appealing a denial of coverage, but how to write a letter that is effective and that meets your needs and also the needs of the insurance companies. And then we're also going to have an open answer and question session. So this is the time that you get a chance to ask, what's on your mind. And today's panelists, I'm going to just quickly say who I am, who this weird voice is behind the screen is. I'm Juanita Panliner. I work with the Spina Bifida Association, and I'm the National Resource Center manager. But today we're going to be listening to some really awesome and knowledgeable panelists, and I'll let each of them introduce themselves. And let's start with Monica.
Hi there, I'm Monica Still. I'm a retired home health administrator, and I'm an adult with spina bifida. I work with the Spina Bifida Association, and I'm part of Disability Rights PA.
Okay, thank you, Monica. And Karen.
Hi, my name's Karen Kushner. I'm an adult with spina bifida. I work with the City of Albuquerque's Americans with Disabilities Advisory Board, and I also am an adult that's on the SB board, and I do a lot of local, state, and federal advocacy for spina bifida and for service animals.
Thank you, Karen. And Ellen.
Hi, I'm Ellen Freemian. I'm a med peds doctor, so that means that I train to take care of both adults and children. And I work in Houston at the Baylor College of Medicine Transition Clinic, which is a clinic for adults with disabilities. And then I also have a transition program at Texas Children's Hospital to help with teenagers transitioning into adult care and changing their insurance and doctors and all of those things. I also am a member of the Provider Advisory Council for the Spina Bifida Association.
Thank you, everybody. And as we continue, I just wanted to ask if people might be able to, if you're not speaking, you could please go ahead and mute yourselves as well, just so we can cut down on background noise, and let me know if I'm the one causing the background noise as well. So like I mentioned at the outset, please use your chat function or your question or the question function to send in what your personal questions are. And now Ellen is going to discuss, she's going to do an overview of what it takes to qualify for different types of insurance, and she's going to kind of describe this whole mess to us. So Ellen, it's your turn, please.
Sure. So this part is very important and very confusing. But basically, there are three types of insurance that we have in the United States. The first one is private insurance, or sometimes referred to as commercial insurance. The second one is Medicare, and the third one is Medicaid. Both Medicare and Medicaid are considered public insurance, or things that are provided by the government. So Medicare is federal. That means that that's operates from Washington, D.C., so it applies to all the states. And then Medicaid is state specific. So for example, my co-presenters who live in Pennsylvania and who live in New Mexico have a different plan of Medicaid than we do in Texas. There's definitely some things that are similar, but each state is very specific. And so you need to know what your state Medicaid plan and qualification is. So briefly, and I'll go over these in more detail in just a second. Private insurance you get from your job. So if you work, you'll be asked when you join your company or your job if you would like to be on the job's insurance plan. And then they'll give you a handout during enrollment about the different benefits and packages that they offer. So you want to definitely look at all of that. The other way that you can receive insurance is on your family's plan. So if you're an adult who still lives with your family, you can be on your family's insurance plan up to age 26, or longer if you have a disability that makes you not able to work. The other way is that if you're married or you live with somebody as your partner, you can be on their plan if their job offers them insurance. The last one is the healthcare marketplace or Obamacare, and those plans are offered if you don't have other insurance options. So that's private insurance. You can have private insurance as well as public insurance in some cases. So the next one is Medicare. Medicare is a benefit for those who have worked. So you have to qualify for SSDI through the Social Security Administration, and I'll say what that means in just a little second. And then finally, Medicaid. Medicaid rules are different in each state. First, the pediatric Medicaid is pretty easy. So if you're under 18 and your household income, that means your parents, your family who you live with, meets criteria for low income based upon the number of people in the household, you can possibly qualify for Medicaid up until the age of 18. Over 18, it gets a little bit more tricky and more state specific. But a lot of times you have to meet disability requirements, which you have to go through the Social Security Administration. And this disability requirement means that you cannot work 40 hours and therefore get private. So that's a little tricky. And you also have to meet income qualifications. And in some states, just low income alone can help you get Medicaid, or if you're pregnant as a woman, or if you're taking care of a child that has Medicaid. But again, those rules are very tricky, and you need to possibly have your social worker help you determine if you're eligible for those things. The other thing to know is there is a federal or a United States law that says if you have disability determination, then states cannot deny you Medicaid. Sometimes you can work so much that your income makes you no longer eligible for Medicaid. But there's Medicaid buy-in plans and other things and other rules that you need to be aware of where you could possibly receive Medicaid if you don't have other insurance. And again, you can have dual insurance with Medicare and Medicaid if you qualify for both, and those are kind of tricky to follow. All right, so next slide, please. So a little bit more just to review about private insurance. Again, you can get it because you work and your employer gives you benefits, but you want to really look at those plans and the deductibles. They usually give you a chart that's very helpful, and you can even go over those things with your HR person. Married, you're not going to be eligible to be on your parents' plan because you're considered independent. The other thing is that there are some people that have a disability and still live in their parents' home. They can qualify to be on their parents' plan as a dependent past the age of 26. But it's important that whoever is the person receiving the insurance, like it's your mom or dad, get a statement of disability for you from their employer and have your doctor sign that before the age of 26. So what that paper looks like is they describe that you have spina bifida, you were born with it, and therefore you're not able to work full time. Hello. Sorry about that. Can everybody hear me?
Yes, yes, we can hear you. I apologize. I'm not sure what happened too, because all of a sudden again, I've been hitting buttons this time and I've been knocking people out of things. So here, let me go back. Sorry about that, Ellen. All right, so are we still in this slide here?
I can't see your screen anymore. Maybe just me, speaker view.
No, that's my
I think
fault.
you're going to have to share again, Juanita.
Yeah, I can't see
Okay.
your screen either.
But Karen or Monica, did you have anything to add about private insurance?
As far as private insurance goes, not right now.
Okay, sorry about that. I'm not sure what's happening here. Okay, why is this not sharing? Sorry, everybody over there. We'll get this fixed quickly. Okay, so that's that. And then why is this not sharing?
Doesn't play well with others today.
No, definitely not playing well with others today. Oh, here we go. There we go. Boop. Okay. All right.
So we're
Here we go.
on
Can you see this?
to Medicare.
Yes. Thank you, everybody. All right. And we were done with this. We did this.
Done with private insurance. Okay, now we get more complicated.
Okay.
Okay, so Medicare, as I said, is a federal plan. That means it's the same across all the United States. But you have to qualify for Social Security Disability Insurance, or SSDI, in order to qualify for Medicare. How do you do that? So one, you have worked 40 quarters. That's about 10 years. And then you have a disability such that you can no longer work or you retire. So in your paycheck stub, you'll notice that there's Medicare withholding at the bottom of it. It looks like a tax on there. And that is your earnings for Medicare when you retire. So you can always be excited about all that money. The other thing is if you still live at home with your parents and they qualify. So say your mom or dad retire and then they're eligible for SSDI. If you still live at home and you qualify as a person with a disability and a dependent as an adult, then you can qualify as a dependent on their SSDI. So you'll start receiving SSDI, but you won't get your Medicare insurance for 2 years after that income starts. So you start receiving that money as a check or a deposit, and then in 2 years your Medicare will kick in. The other way is if you're married and your spouse retires or they start qualifying, then you can receive it that way. The other thing is if you have a parent who dies or and they worked and are able to receive SSDI death benefit, then as a minor, meaning less than 18, or as an adult, you need to go over with a social worker because it's quite confusing. And then lastly, if you qualify for end-stage kidney disease and you're on dialysis, or if you receive a transplant. Now, if you get an organ transplant, your Medicare only lasts for a couple of years and then it's going to fall off. So you're good to go. So Medicare is very tricky, and the way you qualify is quite tricky. But I think it's important to know that if you're still a dependent, meaning that you can't work and you're not financially independent, you're still living at home, and your parents qualify for Medicare, you can qualify for Medicare. And then lastly, if your parents have passed away and they worked, you can also qualify for Medicare. Those are the two situations that I find that patients are surprised when they actually qualify for Medicare. And it's important to note this because if you start receiving SSDI income, sometimes that can mess up your Medicare. I'm sorry, your Medicaid. So SSDI, Medicare, SSI, Medicaid. And I'll tell you about that in just a second. There's some information. You can go to medicare.gov, your local center for independent living, or your Social Security office to find out more information. Because there's all types of Medicare plans, there's different plan parts, and it's really confusing to go through that. So that's more like on an individual basis. The important take-home message is, when could you possibly qualify for Medicare? Anything, Karen or Monica?
Yeah, the other thing that you qualify for Medicare automatically is if you have ALS. And I saw the question that somebody said stage 3 kidney disease. It's once you go on dialysis that you qualify for Medicare. So it's end stage kidney disease. It's not necessarily stage 3. It's if you go on dialysis.
Perfect. Okay, and we're ready for the next slide, Juanita. Okay, Medicaid. So notice the difference in the last part of the name. So Medicare is what we just talked about. Now we're talking about Medicaid. Medicaid, again, is state dependent. So every state's going to have a different Medicaid plan and how they manage it. You have to qualify based on your income. Now, if you live with your family, all they need to look at as an adult is your personal income, not your mom's, not your dad's, not your great aunt, whoever, whatever's in your bank account under your name. This is important because sometimes you can be gifted some money, or say somebody passes away and they leave you a lot of money. It's better for that money to go into a trust fund, and there's special needs trust, which we can talk about. But they're going to look at your bank account to see if you meet qualifications in order to be eligible for Medicaid. You also have to do disability status. Disability determination, the criteria is actually federal. It comes from the Federal Social Security Administration, but how it's determined is on the state level. So you have to go to the Social Security office, and there's a doctor that does an exam, and you have to meet with a case manager to review all of the information. So that's a little bit of a process, but everybody has to do that. Even if you've done it as a kid, you have to redo that at age 18 when you become an adult. All right, so that's the most important thing. And pediatric Medicaid will stop sometimes at age 18 if you don't do this adult determination process. So 18 is a very important age. Many states have managed care organizations or companies that run their Medicaid plan. So for example, there's a United Healthcare Medicare plan and Medicaid plan that's available in Texas. There's many other ones as well. Each state should have a listing of their Medicaid plan. You want to look and make sure that your doctors that you see accept that insurance, or that they at least can help you with the out-of-network authorization or something like that. But it's important to understand what your doctor accepts. The other thing about managed care plans is they have a service coordinator or somebody that can help you understand what your insurance will cover, that you can contact over the phone. The way that you find out the number to that person is you look on your card and it'll say, I need to contact my service coordinator or case manager, and call that number and find out who that person is. That person can help you understand your benefits, find doctors in network, understand what's being covered for you, and also help you with any other things like provider hours, which can help you with things you need at home, or nursing services if you're having difficulty with a medication or wound or cathing and that sort of thing. Oftentimes the website has a listing of those things, but if you need help from a person, your service coordinator, a case manager through your Medicaid plan is the person to contact. All right, and that's it for me.
Very good. Thank you so much, Ellen. That was a lot. And just like you said, just like there's all that information that you provided, there's probably a lot more that goes into that. So anyway, so thank you so much. And Karen, what else do we need to know?
There's a couple more things you need to know. All insurance is state dependent. So you need, even though, as Ellen said, there's Medicaid and Medicare. Medicare is the federal plan. Medicaid plans can vary from state to state, just like commercial or private pay insurances can. So it's really important that you're looking them up, because every state is regulated by an insurance commission or commissioner of some sort, and the state has its own rules and regulations about what they will cover and won't cover as a larger picture. The next thing to think about is to look beyond the premiums. A lot of times these insurance companies, they will advertise to you as there's, no out of pocket, there's no monthly premium, but then they don't cover a lot of things. So you need to really look and make sure that everything that you need, that you will need for your care, from physical therapy to occupational therapy to your private specialists, make sure that they're all in there. And because if it isn't in the policy coverage, it isn't going to be covered later. You're not going to be able to argue it later that this is a covered benefit when it was never there to begin with. The next thing is to see, is there a co-insurance with your private plan for certain things you need to have done? If you have to have an MRI done every, year or 2 years, 4 years, whatever it is, what is that supplementary co-insurance going to be? Does the private plan have it? Does a public plan have it? Medicare has co-insurances that you have to pay. Medicare doesn't cover everything. What is the pharmacy coverage? Is there any pharmacy coverage? In this day and age, a lot of plans have decided that pharmacy coverage is an add-on. So you need to make sure that you have pharmacy coverage, and also, again, in that pharmacy coverage, make sure you're looking at what you're taking, what medications you're taking, making sure that medication is covered, making sure that it's not an exception, so that every single time you have to get it filled, you have to get a letter from your doctor and explain why. I mean, there's going to be times, don't get me wrong, where you do have to have insurance. You get to have a little bit of a back and forth with them about what they will cover and why. Everyone does that and has that at some point, but just make sure that your basic medications are covered. And also that the copay for that isn't going to be outrageous, and that the pharmacy add-on coverage is reasonable. The next thing is durable medical equipment, and that includes urologic and incontinence supplies. Sometimes insurance will cover urologic and they won't cover incontinence, and vice versa. Some will cover all. Durable medical equipment includes wheelchairs. Some insurance companies have gotten really funny about covering DME and putting a cap on it. For instance, my personal insurance, it is now at $1,500 a year. That's hardly enough for me to replace my wheelchair. I just have to keep replacing pieces and parts, and hopefully in a few years I'll rebuild a new one, but I'm just saying it's something you need to look at. And then, is home health care and or skilled nursing facility covered? That's very important. Home health care is actually in your home, having somebody come, whether that's a wound nurse or a nurse, home health care aides to help you do things with your personal health at home, such as bathing, taking care of the minor things in life that you need that you wouldn't be able to do for yourself. And then a skilled nursing facility is those times when you might have a surgery and need to have a skilled nursing facility for a certain amount of time of recovery afterwards, or where you might need to be for some basis of time to recover your health and be able to go back home. So those are two very important things to look at in policies. A lot of times, again, if it's not in the policy, you're not going to be able to argue it later that this should have been covered. That's about all I have for that.
Thank you so much, Karen. So Monica, it's your turn to tell us what we need to know about insurance coverage.
Okay, and some of what you need to look at is what is the maximum out-of-pocket expenses. And what that is the most amount of money that you are personally going to pay for before your insurance goes to pay at 100%. Now, 100% sounds great, except that most of the time, the maximum out-of-pocket can exceed over $5,000. So that's a lot of money to pay out of your pocket before your insurance pays at 100%. And usually, if you have a lower maximum out-of-pocket, like say $2,000 or $3,000, you're going to be paying more of an insurance rate. You need to sort of look at and calculate like a ballpark area for your expenses. You need to look at this insurance and not just look at how much it's going to cost you per month for the insurance itself, but knowing about how many doctor's appointments you might have that month and how much many copays you're going to have, how much your pharmacy costs, if they pay for durable medical equipment, and if they pay for urologic supplies like catheters, to know that if they pay for it, that's great, but do you have a copay with that catheter and how much do you use? Or if they don't pay for it at all and you're going to pay for that yourself. And also with incontinence supplies, most insurances don't pay for incontinence supplies, or to be really honest here, what they pay for, like the brands that they pay for, really don't work well. So, you know, looking at what you're going to pay for yourself. And then also look at what doctors, clinicians, if the physical therapist you like is on there, home health agency you like to go to, if you've been in rehab before or been in a skilled nursing facility before, are these covered by that plan? Because there's nothing worse than taking a plan and looking at it and going, wow, this doctor I really like isn't on there. And especially since we have spina bifida, that's even a whole other layer, because inevitably you get somebody who might know spina bifida, but usually they don't. So to make sure that the doctors who know about spina bifida and being an adult with spina bifida are on the plan.
Right.
If we do the next slide.
Absolutely. And as we, before we do that, I just want to say, so in terms of this information that you've provided, and then, you know, even just thinking about the clinicians and if they're in the plan, like all of that is going to take a lot of work, a lot of legwork to find that out.
Yep. It takes a lot of legwork, and you can go online sometimes and they'll list what doctors are on there. But honestly, the best way is to ask your doctor, because their billing department knows exactly who they bill. And insurance companies, they don't always update their information in a timely manner. So you may think your doctor's on it and it says so on their website, but then you find out from your doctor that they're not. So, and sometimes it can be even very strange and confusing, because this one plan on this insurance your doctor goes for, but this other plan doesn't. So it's just kind of best to ask your doctor. The other thing you need to do is kind of anticipate your medical needs for the year. I not only have spina bifida, but I am an amputee. So the insurance that I choose has durable medical equipment, and it's paid for by the insurance at 100%. Because my prosthetic leg costs roughly $30,000, and I get one every 3 years. So if I had a 20% copay, or some of them have 50% copays, I'd be spending a whole lot of money that I don't have. And sometimes places like prosthetics places, they want their money up front, which does not make life fun. So know what you're going to have the next year. You know, that's the one kind of, I don't know if it's a good thing, but I guess it's one of the things about spina bifida, we can probably guess what we need. We know how often if we have a shunt, we have to have an MRI or something, or we know how often we get incontinence supplies. So other than, you know, other people who don't know what they have, we kind of know what we're going to need. You know, ask what treatments are covered. You know, is what you need covered? Will they pay for, I know some things don't look at, like, bariatric chambers for wound care and stuff, to find out what the requirements for that and if they pay for it. You know, to look at also if custodial care is involved. Custodial care is a very fancy medical term that I apologize for, that means long-term care. It basically means you need a PCA for help. And do they pay for any of that? Because if they don't pay for that and you need that care, then maybe you need to look at either waiver programs or Medicaid in your state. And also, is short or long-term rehab care included? You know, is short or long-term rehab care included? If you need to go from we all know that hospitals don't keep us as long as they used to. And do you have to go, but you're not ready to go home? Will they pay for a rehab for you to build yourself back up and get back to where you were? What services and products require pre-authorization? This is so important, because if it says in your policy, you need to pre-authorize this treatment, you need to get permission basically to have this new wheelchair, to have this catheter, to whatever it is. If you don't get pre-authorization, they won't pay for it, they'll deny it, and it's going to come out of your pocket because you broke their rules. Some insurers publish guides to help you select insurance coverage. Don't look at them as guides. They call them guides. They're not guides. They are basically ads. They're advertisements. They're commercials for their insurance. They're going to punch out and say every great thing that is wonderful about their insurance. You can have this and you can have that. You can have, you know, we pay for a gym, or we'll pay for your transportation, or we do this better than another insurance. And then if you look at the fine print, you find that the stuff you do need isn't paid for, but this extra stuff is. So you really have to be careful, and you have to be an informed consumer. You have to look at everything and just be aware. And next slide. And Karen.
So before you agree to coverage, because even if you have your coverage through your employer, if you have to go to a state website and an insurance exchange, you have to apply first. You have to fill out everything for whatever plan that you'd like, and hopefully they'll cover you. Sometimes they won't. Most of the time with a group insurance through an employer, even with the different pre-existing conditions that we might have with spina bifida, they usually will cover us. But if you have to go to an insurance exchange, you do have to fill out the policy. Usually you have to submit medical records. Sometimes it can take weeks to over 30 days to see if you qualify for that. So you just have to make sure that the plan that you've chosen and you've applied for, you do have to wait and make sure that you qualify for the plan that you're applying for. The second thing is to check Medicare.gov to confirm the cost of the plans, because every state-run iteration like Humana or United Healthcare, Kaiser, whoever it is, Blue Cross Blue Shield that runs a Medicare program, they have to adhere to all the same guidelines across the country when it comes to Medicare-based coverage for those plans that are administering them for Medicare. So you can go to Medicare.gov just to confirm the plans. You can read and compare the fine print on your private insurance providers. At open enrollment, they'll have many different plans, whether that's open enrollment through your employer. You might have 2 or 3 plans that your parents or your spouse or your partner or yourself that you can look at and decide what plan is best for me. But make sure, again, you always read the fine print. Same with Medicare and all the different Medicare options. Like we were told by Monica, some of them have really fancy, fun things that they've added in there, but then they don't cover other things that you really need to have for yourself. So make sure. Then you can also check the insurance resources in your state, whether that's through the local AARP can help you sometimes with that. The counselors at your doctor's office, the people that bill insurance, sometimes the medical practice administrators, you can put that out there. You can message your doctor and say, hey, I need help with this. I have a question. There's always somebody locally that can answer those questions for you. I know in my state, we have an insurance ombudsman. They also have that at the local university health center. They have an insurance ombudsman, and sometimes they're just called ombudsmen, that can help you answer some of those questions. So again, I just keep saying, read the fine print.
And a lot of times it's really fine. And so, okay, so now we've got all this information, you're equipped with all of this, but you had a service and you were denied coverage. So now what do you do? And so Monica, take us through what you're supposed to do when you're denied coverage.
Okay. Well, the first thing is when you get some kind of service from your doctor, or say you need a wheelchair or something, make sure you follow their rules. That's the first thing. And say you follow all their rules, and then you're still denied coverage. What do you do? Well, first of all is don't panic. You're going to get something called an explanation of benefits that will tell you why it was denied. And by law, they have to tell you that. They have to tell you why it was denied. So you need to understand why your claim was denied. If the requested service is not listed as a covered benefit, it simply won't be covered. So if your insurance, whatever it is, says that we do not pay for catheters, and you bill them and they get billed for catheters, they're not going to pay, and you're kind of stuck. So if it's something that is not in your policy, then you really can't get anywhere. But if it is something that should be covered, or sometimes there's gray areas, there's some things that you should do to help. First of all, tell your doctor's office. You might need a letter of medical necessity. I have a wound on my leg, and they did not want to pay for dressing that my doctor had ordered. So I asked my doctor to write a letter of medical necessity that spelled out exactly why I needed this particular treatment, and then I got it approved. Also look at if it's an easy fix. Sometimes you'll see something that's a technical denial. They'll call it a technical denial. Your name is misspelled. Usually in this day and age, it's a wrong code or some kind of other errors. That's another reason to talk to your doctor's office or the provider, because they're the ones that can fix the code. You and I don't know what the codes are, but that kind of simple fix might be something that goes through fairly easy and isn't that hard to do. So that's why you shouldn't panic, because you never know. No does not necessarily mean no in the first place unless it's not in your policy. Juanita, can we do the next slide? Okay. I'm going to ask you to be a really good record keeper now, because the thing is that if you're going through an appeal, especially if it's something like a wheelchair, and say there's a certain piece of the wheelchair that they don't want to pay for. They don't want to pay for a specific seat. And you know why you need it. You need to write down and keep very good notes of dates and times and who you spoke to and when. Because if you speak to someone on the phone, they're keeping notes. So you want to keep your own notes so that you know exactly what you've said to when, to who and when, because it gets confusing. I don't know about you, but if I have gone through things where I've talked to 5 different people, and I can't tell you at the end of that time, because it's 4 hours later, and gee, did I talk to Gina about this, or did I talk to Suzanne about that? So it's very important to just keep track of things and names and times and dates. Also be aware of deadlines. The insurance company gives you a specific period of time to make an appeal. So if you have 24 hours, 48 hours, 30 days, make sure that you are aware of the deadlines and what you have to submit by when. And make sure that you submit the right paperwork, what they're asking for, and for goodness sakes, keep copies. I swear every company has a black hole where certain things end up. I found that the best thing about the computer age is to be able to email things to people, and then I have a copy on my computer, which is awesome. You don't have to have 10,000 papers around. Ask to speak to supervisors. If you're talking to somebody who is just answering for the phone at the insurance, odds are they're not going to be, they can tell you exactly what the company has told them to say, but they don't have any authorization to go further. So you keep asking for supervisors and who you can speak to further. Also ask if there's a nurse case manager. For my wound care issues, I asked for a nurse case manager who specifically did wound care. And that ended up the best way to do this because she understood what I was talking about. Just as an example, when they denied my wound care product, the doctor who denied it wasn't a wound care doctor. He was just a doctor at the insurance, and he happened to be a colorectal surgeon who knew absolutely nothing about wound care. So it was really good to get a wound care specialist and then to submit the paperwork that way and get it approved. And just remain courteous. Remain, you know, what your grandmother said, you get more flies with honey than with vinegar is true. It might be very upsetting. It might be very frustrating, but it's the best thing just to be very calm, cool, collected, and professional. And the next slide. And the explanation of benefits letter. Really read it carefully. Read the letter well. It describes not just because you want to know why you were denied, but it describes the appeal process in detail. It will say, my insurance says it calls it a grievance. If you disagree with this decision, you may do this. And that's what it is. And all providers have you go through the steps and do the steps that they say. Always follow their rules. That's the one key to this, is following their rules. All providers have a different process, even Medicare and Medicaid. And if it's managed Medicare or managed Medicaid, that process might be different than if it was just regular Medicare or Medicaid. Every insurance provider has to be able to justify their denial. And they all answer to somebody, whether it's the government or an accrediting body. There is somebody that they have to answer to why they said no to your care. Providers are required by federal law to give you a full explanation in writing for their denial and appeals process. I think I said that before. So just really look carefully at things. I know it can be very overwhelming that you have this piece of paper that lists all this stuff and you go, ah, and the first word is we deny, you know, the first 3 words are we deny your care. Take a deep breath, read it through, be calm, and figure out your plan of attack. Okay? And then the next thing you do is, if you see all their rules, see what they want, you submit your appeal. And they have, just as you have deadlines for when you have to put stuff in, you have to wait for their response, but they have a deadline for that. Usually it's 30 days or 60 days. It depends on what the issue is. If it's something that's urgent, you can ask for something, it's called an expedited appeal or urgent appeal. Everybody uses a little bit different language, but basically what it comes down to is, I need this and I need this fast. So make sure that you, you know, are aware of when they're supposed to respond to you. And keep track of their response time. You know, make sure that you keep track of it. And if you don't hear from them, by all means, contact them again. Say, gee, I sent you my appeal. Did you get it? Are you working on it? Where are we in the process? And generally what I do is I give them a week to respond. you should get a response from them saying, we got your appeal. They may not give you an answer right away, but within a week, usually it's within like 72 hours, they give you a response that says, hey, we got this, we're working on it. And that's pretty much what you're looking for.
Thank you. Thank you, Monica. All right, so you followed all the steps. You did exactly what you had to do. You read the explanation of benefits, and you waited, and then you were denied again. So now we're going to talk about, now Karen's going to explain to us what's going to happen or what you need to do if you've been denied again.
So the first thing you have to do when you're denied, you'll get that denial letter in the mail. You need to read it and read it thoroughly, because again, they will list in that letter what your next steps are. It may even have the address or the fax number or telephone number of where you need to send the next step in your appeal process. The other thing is, and I just did this with a good friend, I explained to her, she said, well, this should be covered. You know, this was an emergency room and it was out of network and it should have been covered. I said, you need to go back to your policy handbook. You need to go back to what it says is covered, what the exceptions are, what their definitions are, and basically copy and paste verbatim into your next step appeal letter what they're supposed to cover for you. And everybody who has coverage does get, you get some kind of a handbook. You get, you may get a link in an email that says, here's what's, you know, here's what your policy states. You need to always have access to that, because they're giving you the keys to the kingdom of what will be covered and how to make it happen in the second and third appeal step process. So the next thing you need to do is you can either request an external review, depending on the insurance. If it's a private pay or commercial insurance, it'll probably be, next step will be a fair hearing or a peer-to-peer review. It'll be put up the food chain, up the ladder to someone else, not the colorectal surgeon that Monica had. It'll be somebody else who maybe understands what it is that you have and why spina bifida is so special and why we need to have the things we have. In an outside hearing or an external review, that would be for Medicare or Medicaid. You would ask them to, you know, you'd write them a letter and say, hey, I don't think this is right. And, you know, these are the things I object to. Again, be courteous, be as detailed as possible, say why you needed it, kind of delineate every single thing you possibly can without making it a novel, and go, you know, send that back to them and say, this is why I need you to cover this and why it should be covered. And also make sure you just include the information from their own policy handbooks back in that letter, because that's something they can't deny. It's right there. It's what they said they'd cover, and now you're calling them on the carpet. It is also good to know that the stated external review process would have information on that. If you might get it from your insurance provider, like Monica, if her first appeal was denied, it will probably have that second, you know, step where she can go, what's the next level, what she can do. And then there's other local advocacy resources that you can go to. I do say, you know, I did say before, there's an insurance ombudsman in our state. There's insurance ombudsman at the University Medical Center that you can call up and say, hey, can you help me with this? Why wasn't this covered? There's Disability Rights is the name of the group, and it's in every single state, and it's funded federally. Sometimes at some particular times in the year, there should be people there that can then help you with that, or they can source you to somebody in the community that could possibly help you. So the other things to remember is that the review, if it's for state or federal government, that's done, once that next level appeal's done and they come back and they say, oops, sorry, you're out, we're not covering this, that's it. You've gone as high as you can go to get something covered. That state or federal agency, Medicare, the external review source, they have the final say. With insurance companies, with private pay through your employer or your spouse's employer, your partner's employer, your own employer, they have a lot of times snuck into the policies in their clauses where it says binding arbitration is in their policy. And it's just something that you can go to the table before, it's like a step before you hire an attorney and sue everybody you possibly can, which I don't advocate for. But if you go to the table and talk to them, they will have, their medical people and probably an insurance administrator and then an attorney at the table. And then you come and you present all of your information. It could happen in a day. It could be a series of meetings, but they get to say, they would work out kind of like a bargained agreement, a compromise of what they will cover and what they won't. And that is kind of the last step that you have with a private insurance company. Next slide, please. Lastly, I say, don't do this alone. Ask for help. Ask for the resources. There's a Center for Medicare Advocacy. You can go on medicare.gov and see in your state. You can click on your state and see what resources they have, people you can talk to. The local disability rights lawyers, again, that would be people in the state that maybe would do some pro bono work that would help you kind of sort through what should have been covered, what should have been paid, how do I navigate this? I've got this $10,000 bill I can't pay. There's those people that can help. They are also part of the disability rights organizations in every state. There's a disability rights in New Mexico, there's a disability rights in Pennsylvania, in Ohio. It's called different things for different states, but they're all federally funded, and they're there for us to ask questions. There's the Center for Independent Living. There's vocational rehab services that you can ask different, I can't remember the acronym right now, but New Mexico has one, and that it's a disability vocational rehab group within the state system that you can call and ask these questions. The local legal aid services, there are advocates that do this kind of work privately and usually at no cost. Some do charge, but they do help you navigate through the different steps. And then you can also research additional resources. I would say, start in your doctor's office, tell your doctor, hey, I had this done. It's now not covered. I didn't know it wasn't going to be covered. The doctor has an incentive to help you because they want to get paid. So if you can get them to help you write the letters, provide the information to you that you need, they're going to like that as well, because they may not have known that a service wasn't covered. Their insurance person that they have working in the office, their billing person may have just assumed it was covered. And it could go all the way back to the beginning where maybe they put the wrong code or they put the wrong diagnosis. You have to try to be your own detective and see why this wasn't paid. So that's what I would recommend, is always ask for help. And then sometimes, you can ask SBA for help. You can ask us for help. We're here.
Thank you so much, Karen. That was really, really helpful here. And now before we move on to your questions, there was just one more thing and Karen, you touched on this, but there was a point too, specifically for adults who have spina bifida. One of the points, or one of the main things that people are interested in is independence. And so how does this information help to equip people for independence? Did you want to discuss that a little bit, Karen?
Sure. I think that some of the information we've provided today is helpful for parents of children with spina bifida, but ultimately we as adults with spina bifida have had to navigate this because we want to live independently. We want to have productive lives, and we want to be part of society. And being part of that means that, you know, we may not always be on our parents' insurance. We may not always qualify from state to state with what's going on as far as, you know, the insurance in Medicaid may not be reciprocity into Texas, into Pennsylvania, into New York. So you have to be prepared to be the educator, to understand what's going on, and to also understand that you're an adult living with something that you were born with. And we don't want to be the people that are not living independently, and that are not looked at as having productive lives, even from the time that their children transitioning into adult care. I think it's very important that parents understand that there comes a time when the children really need to take ownership of some of this, if it's at all possible, and if they're able to work, if they're able to be productive in society, that is a good transition time for them to start understanding it and owning it.
Thank you so much. All right, so we did get one question, and this is actually a question that we get a lot, specifically regarding Peristeen. And so I'll read the question. And basically that it's expensive. And it's the Peristeen, and it's the transanal irrigation system. And many people have been told that insurance won't cover it, or that it will be very difficult to get insurance to get it covered. Now, in the case of this person who has an employer's insurance, they have an $88,100 deductible. So even if they would say yes to Peristeen, it won't meet the deductible. So then this person reached out to Coloplast to see if they offer any assistance. They don't. And so, you know, $7,000 a year out of pocket is definitely out of reach. So what would be some of your recommendations?
So this is Ellen Freemian. So I'm, like I said, I'm a physician that helps both teenagers and adults. And I've done Peristeen for a few of my patients. I know there's some other centers that have a lot more experience. Getting Peristeen covered is quite an undertaking. First, the doctor that's prescribing it has to have Coloplast nurses come and train their nurses on how to teach Peristeen to the patients, and also how to help if there are problems. So that's step one so that has to be done. Next, for insurance coverage, you have to write a very extensive letter of medical necessity. Coloplast can provide some of the evidence for that, some of the papers that have supported Peristeen. And in that letter of medical necessity, I always recommend the following format. So you want to describe your underlying condition that makes that whatever you're going for Peristeen in this situation medically necessary. So neurogenic bowel and spina bifida, and talk about the problems of having risk for bladder infections, for incontinence, for hospitalization due to constipation or obstruction, and all of those things that make it medically necessary. You also want to include things that you have tried and failed. A lot of times the insurance companies, their doctors that are reviewing this, they need to have good evidence to support something that's more expensive or not common to their insurance program. So for example, you need to say that you've tried laxative medications, enemas, cone enemas, all those things. And if you haven't tried all those things, I really, really recommend that you give those a good couple of months to try out before trying to pursue a Peristeen, or while you're trying to pursue Peristeen, because the insurance company will be looking for that evidence that you failed other things. And then after that, then you have to see if with that letter that it's a covered benefit. Obviously, the handbooks probably won't talk about Peristeen since it's relatively new and not as common in the United States to use. But that's all the information that needs to be included. And you really need to have a case why that's absolutely the necessary next step and what you've tried and failed.
Unfortunately, in this particular case, though, you can have all that, but since his deductible is $8,100, it's just not going to happen. It's one of those things that you have to look at the insurance policy, and I don't know if this is what he was offered through his employer and this was his only choice, but this is where reading the fine print, because that is, the only, that's the problem here. You're stuck. And when you're talking about the letter of medical necessity, even when you're talking about appeals, one of the things that I found that works well is explaining to the insurance company how it's going to cost them more if they don't do what you want them to do. Like in my case, when I talk about my wound care on my leg, I talk about how much more it's going to cost them if I end up a double amputee.
Right.
Hospitalizations and ER visits are always important to include. So if you've had prior hospitalizations and ER visits, especially within the last year due to that condition, it's very important to document those, because that's the most expensive thing that an insurance company has to pay for is hospitalizations and ER visits. So those are the things everybody's trying to avoid.
Okay. And Carrie, did you have a thought about how much this might work in New Mexico?
Oh, I agree completely with Monica that this is just plan specific, because the person has such a high deductible. There's really not much he can do other than maybe if he has the option every year to change plans, to then, at his next open enrollment, to look at what will cover, whether it's, through his private insurance or through his Medicare plan or HMO, PPO. He just needs to look and see what will be covered and look forward if this is something he's going to need to option in the future. I guess my only other question would be, or suggestion is, and maybe Ellen would know this, is the company that produces the Peristeen, do they have any patient assist programs? I mean, that would be, okay. That would be that would be another way to go, is to contact the maker of the drug and say, hey, I need this all the time. And could you, is there any help with this? So.
And it even gets tricky even once you've been approved for Peristeen, if you go through all of this, because you have to get supplies and you have to get new products, the catheters and the different things. And I had somebody who had theirs break, and then it's still very difficult to get Peristeen. So you really want to exhaust all those other options that might be more easily covered, and talk with your doctor about what kind of bowel management would work best for you. It's really hard.
And I have two questions about that. One, just mine, because in this case, it's based on this person's employer has provided this insurance. So like you mentioned, for next year, for the next open enrollment, might this person then be able to consider like buying some kind of supplemental insurance that, but obviously, finding out if that supplemental insurance would even cover the Peristeen? I mean, I don't know if that would be possible, but is that something that you've heard people try to do before? Anyone?
You usually get supplemental insurance with like Medicare and stuff, but when you're disabled, it's more difficult to do. By law, they're supposed to, but they don't. This is a private insurance, and unless he has a spouse who also has private insurance, that, you can have extra insurance. But I mean, if my deductible was $8,100, I don't know how I would pay for another insurance on top of that. You can't really look at the marketplace. I mean, I don't think that there is an option for that with this.
Okay. Right.
Yeah, I think if Medicare doesn't pay for it, the supplemental is probably not going to pay for it. And that's why the private insurances don't pay for it right yet, because it's not widely accepted by and covered by Medicare as a treatment.
And they've been working on that for at least 3 years now, trying to get Medicare to accept it.
It's a very good point that many insurance companies, as well as Medicaid, follow what Medicare does. So it's not a written rule, but that's pretty much how it happens. So that's always what people go by. The other thing about Medicare is it's really meant for the elderly population. That's the largest group of people that utilizes Medicare. So oftentimes for people that have developmental or congenital disabilities and conditions, it's really difficult for them to kind of fit into the Medicare program because you don't meet what their typical population needs. So that's why we have to really advocate.
And we had one question asking about since Peristeen would be so essential to, and by the way, thank you so much for hanging in there because I know we're a little bit over time. But since Peristeen is so essential for work, to be able to be independent and go to work, etc., what role might the Department of Vocational Rehabilitation play in this?
Depending on the state and what their funding is, I know for the state of Connecticut, when I lived in Connecticut, if I needed a prosthetic leg to be able to work, that they would pay for the prosthetic leg, because at the time, my insurance didn't cover, my husband's insurance didn't cover prosthetics at all. And my leg broke and I needed a new one in order to work, and OVR paid for that. However, I don't think OVR really is set up to pay for, you know, it's with Peristeen, it's not just the initial startup, it's all the supply, like Ellen said, it's all the supplies you need down the road.
Yep.
So I don't think OVR may not be set up for that, and it depends on their funding. You could always ask. You know, you don't know what the answer is until you ask, but just the answer might be no.
Yeah, and that's a good point. I mean, at least ask and find out, because the other thing I'm thinking of, if it costs this much, you know, if they did help like one or a few people get it, then maybe, you know, even more would request it. And I'm not sure how sustainable that would be, even for, you know, the vocational rehabilitation. But like you said, it's always good to ask. So, all right, well, thank you so much, everybody. We are definitely over time. I'll hang in there for just another question if anybody has any other questions to ask our presenters. And, oh, so here's a question. And the question is I don't meet the requirements for Medicare, so can I get Medicaid?
The answer is it depends. So the requirements for Medicare and Medicaid are different, and it depends on which state you're in.
Yep.
So the first thing to do probably would be to look at the Social Security Administration. Is a good place to start, because if you have disability determination, meaning that you cannot work 40 hours a week due to physical or cognitive limitations, and you meet the income requirement, that's probably going to fly in all of the states. But there's some paperwork and some justification that you need to review. So maybe talk with your doctor or a social worker or something like that to make sure that you have all of the documentation that you need. Because I know in Texas, if you mess up your disability determination the first time and you have to do an appeal process, it can be 3 years. And it's very difficult once they make that determination to have a redetermination. So definitely don't go at it alone.
Okay. Thank you, Ellen. And Karen, do you have anything to add?
No, I just agree completely with Ellen. It completely depends on the state, what the state income requirements are, what the household requirements are, and you know, if you already have a letter of disability stating that you can't work, it's just going to be the legwork that you have to put into it of filling out the paperwork, you know, seeing it through the system, which could take, you know, I know my friend, when she applied here, it took 6 months before she finally got an answer and was approved. So it can be a lengthy process.
Okay. And Monica, do you have anything else to add to that?
No, I mean, that's pretty much it. It depends on the state and what the requirements are. That's what makes this so difficult, because the income requirements for every state are a little bit different. So, you know, that's why we can't give a blanket answer.
Yeah. Well, thank you so much to our presenters. Thank you so much for those of you who were able to join live. I'm just scrolling through a page here of some additional materials and some resources. And as we, you know, get more materials or resources related to this topic, we'll go ahead and add them. The entire recorded webinar and the resources will be located, will be saved. You'll be able to find them at this link in our website, spinabifidaassociation.org. and Education SBU. So please look for it in the next day or two. And after we hang up, I think you should be getting, once we have the recording ready, I think you should be able to access that as well. So again, thanks so much to Monica, to Karen, to Ellen for your time. Thank you to Sam for fielding our questions. And thank you, Judy, for joining as well, and all your guidance. And so we'll see you in 2020. Thanks, everybody.
Thank you.
Thank you.
Thank you.
Bye-bye.
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 Bye.